Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center. We are doing Ask the Doctor Anything, our Tuesday night questions from 6 p.m. until 7 p.m. We have the tlcdoctors.com, our website, and there you can get on our newsletter. And at our newsletter, you'll get information about when our next TLC Ask the Doctor YouTube video is occurring. And with that notification is a link. On that link, if you have a question that you would like me to try and answer, you can type it in there and it'll go directly to populate these questions that we get from the email questions. Another way that you're able to get a hold of us is if you're on YouTube as a member, you can type in on the chat the question live, and we'll try also to get a hold of you in that fashion with an answer as I read them during the live time. I'll try and defer to the live questions over the email questions. But anyway, today is September 17th, 2024, and we are a group of integrative doctors here. The goal that we have is to try and do preventative medicine, restorative medicine, and to guide you in a long and healthier life. And that by taking the best of our standard allopathic medical training and mixing it with our vast knowledge of the nutritional and interventional nutritional studies, research, and nutraceutical dietary advice that we've been working with for, close to 50 years now, and we all have quite a bit of experience. And this is not intended to be personal medical advice for any one participant here. Rather, these are my general practice responses for functional medicine thoughts that I have to questions you might have. So let's begin with our first email question. And that comes from Deanna. Deanna says, hello, Dr. Rita. What causes elevated prolactin levels? And how does one decrease levels for a 28-year-old female with no children? Well, prolactin is involved. It's released from your pituitary, and maybe the most common cause is a benign prolactinoma, which is a tiny enlargement of that region of the pituitary that produces prolactin. Of course, the prolactin releasing hormone to develop lactation and breasts, but there can be certain antidepressant psychiatric medicines that increase this. There's a strong impact from environmental, you might say, contaminants, plasticizers, chemicals that mess up our hypothalamic and endocrine feedback loops. Therefore, normally we see it elevate in a woman who is breastfeeding or pregnant, and there are certain expectations for it to raise during that time. Outside of that, there are other situations, like I said, certain psychiatric medicines, antidepressants that can do it, but certain metabolic problems like diabetes or hypothyroid, other things that seem to have a central axis impact. Even some strong nutrient deficiencies are associated with abnormal pituitary secretions. So we would ask you to see your doctor so that they could look at your body habitus, because the more overweight you are, the more the tendency for there to be toxins, environmental toxins stored in fat, and that can be circulating and create some signal problems in the endocrine axis, pituitary to the rest of the endocrine system. We would want to do your blood sugar studies, metabolically. The high blood sugar diabetic would have that problem also. It could be a mixture of the sugar problems with the increased fat tissue adiposity and the toxic things that tend to get stored in fat that can be problematic. And then, of course, hypothyroid, which also goes along with the overweight, which goes along with the higher blood sugars, along with obesity and diabetes. So there's a toxic world we're living in, high carb, pushing all of these stressors on our normal homeostasis. And so just work with your doctor and set up a healthy lifestyle, getting up early, trying to go to bed before 10 p.m., get up with the sunrise, ground yourself, put your bare feet in the grass for a couple minutes every morning and let the infrared of the sun penetrate you all the way through your skull. And that will occur within the first couple of minutes, especially if you're barefoot and you can kind of connect electrically with the earth as well. Adequate hydration, exercise, and eating a low carb diet. We're in a highly processed environment, so that'll reduce if you try and eat real food, no processed food. That should help normalize your body system. The exercise, the good sleep cycle, the sun, grounding, earthing, and adequate hydration. These are the beginning point. And if you're 28, I would have someone be checking your estradiol and progesterone. It could be also that you need progesterone day 15 through 25 of your menstrual cycle to help normalize things. I don't know if a neighbor or your sister or someone near to you emotionally connected with is pregnant or breastfeeding, but there are certain psychological, there are wet nurses that didn't have a baby recently, and they then will have elevations in prolactin. You can even see this in the mother of the woman who had a baby recently, or the mother-in-law. Women tend to hormonally mimic if they're in close proximity and often in contact, and they have a psychological, emotional empathy or rhythm with the breastfeeding mother. So it's a fascinating world, and usually this is something that we have a little concern for, and we just monitor it. Anne Marie then asked the question, thank you for answering my question from my friend regarding chronic Lyme's disease. Okay, I passed the information on to her. Thank you. My first question is, can you recommend a dentist since my dentist retired? Yeah, there is the one I'm using now is Jacqueline Unesi, Younesi, Jacqueline Unesi, Younesi. And she's right by Fashion Island on Avocado and PCH, right on the corner there. And she's very reasonable, and she's very, very, very good, and she is excellent in every demeanor. So Jacqueline Unesi is the dentist I would recommend. And then my second question is, where do you buy cosmetics like eyeliner and mascara? I don't do anything particular. I don't search the web for expensive things that claim to be all natural. I use so very little makeup at all, but I just go to the drugstore and get some, lipstick and mascara from Maybelline or CoverGirl. I pretty much do it as, a last minute thing. I don't put myself first. So, sorry, I don't have any suggestions for you there. Let's see. My phone is ringing. I forgot to turn it off. All right, now back to the email questions. Oh, we have a YouTube question. Let's go to that one first. Beth says, hello, Doc. What topical cream would you recommend for an aggravated nerve or the top of the foot? It hurts to walk. Thanks. Well, that could be many, many different things. I don't know how old you are. that your metatarsals, there's quite a few little bones there, and they're what is your weight? What is your body habitus? Do you have any knee replacement, hip replacements? Do you not have any of that? Did you have diabetes? Have you looked at the bottom of your foot? Is there a foot ulcer or something that penetrated and you didn't notice it by neuropathy? It isn't something that I can just suggest. This is something that should be seen, knowing who you are, how old you are, what your body habitus is, what your comorbidities or none may be. But in general, topicals that are in someone who is otherwise without any serious or infectious or unknown foreign body or under their foot where they can't see so well, capsaicin, that's red pepper extract, which is as a topical. That's usually the number one thing that I recommend for a topical cream. And you can get capsaicin at any natural food store or supplement store topically. That would be my recommendation there. But do have that checked out. You might need an x-ray if there is no puncture or heat or localized or diabetes or anything like that. Have it checked out if you're not getting better and you might need an x-ray and you need to stretch. Now, enzymes, systemic enzymes are what I always recommend because inflammation is cleared out naturally in the human body with adequate hydration and systemic enzymes like our vascuzyme systemic enzymes or vitalzyme on an empty stomach. And you could use 5 or 6 twice a day. You could use more. You could use 8 or 10 twice a day. And fasting for 24 hours, just water with the enzymes, is a tremendous anti-inflammatory. So there's many causes, many issues. What kind of shoe do you constantly walk in? Do you walk in high heels often, which will create an unnatural distribution of pressure points over time? Are you overweight? Are you underweight? Do you have back pain? So those things need to all be checked out. Hopefully that's helpful to you, Beth. The next question on the email list is from Jennifer, and she says, I had blood and urine tests done, but have not gone to the doctor for my complete physical yet. What are your thoughts on these, and do you have any suggestions for improvement? And so she lists here the pH 8 that was on her urine, I suppose. On the blood test, creatinine was 0.49. It's called low, but it's not low. I don't go by the standard averages not infrequently. They can be population averages of a sick population of Americans, and a creatinine of 0.49 is just fine. Total cholesterol of 208 is just fine, especially in the light of the fact that your triglycerides you list as 38. That's very, very good. Triglycerides 38 come from carbs. When you eat too many carbs, then your body needs to make little fat molecules out of all the starch and fruit and carbs, and you don't have a lot floating in your blood. Plus, your HDL, it looks like you're active, Jennifer. Your HDL is 100. And when you exercise more, your HDL goes up. So you're in an excellent state, and your LDL at 101. I would say this is fantastic lab. Regarding the pH, I don't know if you're trying to alkalize your body. The urine is supposed to be a little acidic because it's also trying to prevent bacteria, bladder infections, and so forth. So I would follow up on that. Drink adequate water. Amber has the question, I have heard that after 2 COVID vaccines, your immune system significantly turns down, which leads to you becoming sick more often. IgG4 is the immune system's response to itself to turn down. They show huge spikes in this response after your second COVID vaccine. Have you heard anything about this? Yes. Could this lead to autoimmune diseases? yes, it's been suggested and implied that that's happening. We don't fully understand what was in those mRNA injections from Pfizer or Moderna. We don't really know what kind of contaminants they were in. We don't have understanding of batch to batch consistency. There seems to be batch numbers that seem to have had more problematic concern than other batches. And so the data being released had to be fought through legal terms to get released. And once it was won in court, they wanted to suppress the data for 75 years. Once it was overturned, we started getting information in dribs and drabs, maybe like 10,000 or 5,000 pages of information. And this was out of like maybe 400,000 pages worth of information, which they were going to drib and drab it out over the years. What is the organization? What is her name? Wolf. Naomi Wolf. She has a website called iClout.io. Anyway, they have a book, and I think I have it here. Yeah. So this is the book. Now there are later editions. This was the earliest edition. And so these were the document analysis compiled and reviewed by many physicians and lawyers and nurses and people who had the time to keep up with this as they were dribbled out. And they've had updates because more has come out. I got the very first volume. And basically, it's just reams and reams of their data, and then the assessments of what's understood to be being released here. And it's very concerning, the data regarding this. As to what do we do about it now that so many people were pressured through fear of using it, or not knowing enough. Those who have had it have done very well through our services, even at the very beginning in 2020. We emphasized low carb always, and we emphasized zinc supplementation with vitamin D with systemic enzymes. And then, of course, adequate hydration. And then we found that all those that did those kind of things did quite well, and their vitamin D was very immunosupportive, along with the zinc supplementation and a low carb diet, because sugar, starch, and fruit sugar depress the immune system. We also had vitamin C immune drips to help stimulate the immune system in a healthy way with a multi-mineral, multi-B vitamin complex supportive of the function of the needs for metabolism throughout your body, especially your immune function. So we have an immune drip we call the immune drip, and it's largely vitamin C, 25 grams with the multivitamins methylated with the mineral amino acid albion chelated minerals rich in zinc and so forth. And those people who did that, especially with EDTA chelation, really sailed through this quite remarkably. And even some who suffered things like some myocarditis, some strokes, transient ischemic attacks, and blood clots did tremendously well with this protocol that we used ever since the experience of the concern in I think as early as March of 2020. You can look back at some of our videos. I don't know if some were taken down or not, but we had always been ahead of the game, and the long term, we give thanks to the Lord, and the hope are we are fearfully and wonderfully made, and so our body responds very lovely. So these are the things that we've done, and we've seen our patients gradually improve, and do quite well. So I would find a good functional doctor who does those things like high dose vitamin C, immune drips, chelation therapy, uh, low carb diet, fasting, intermittent fasting, adequate hydration with water, exercise, good sleep, waking cycles, getting up with the morning sunshine, with the sunrise, and let that infrared penetrate you for 2 to 3 minutes, grounding your feet with the grass that's wet first thing in the morning, not eating late at night, doing regular exercise, getting in the zinc and certain supplements and systemic enzymes. And everyone has done just wonderfully well, Amber. So I would encourage you about this. I don't know the name of the one YouTuber. He's in, I think, Finland or Norway. He is always usually with a ski cap on and ski glasses, and he does his YouTube on his exercise breaks, and he's talking extensively about the research search on IgG4 and the post mRNA injections. And he, points out the concerns that you can order this book, and he's aware of this production of information. Plus, I think there's a second volume already on it. But the encouraging thing is, practically speaking, we've seen much recovery, and we give the Lord the thanks. So, Amber, I hope that encourages you. But work with your physician, try and find a functional doctor as well to work with your lifestyle. The next question is Mary. Mary says, what are your thoughts on Lipo B12 uh, shots for energy and fat metabolism, MIC? Uh, I wonder what the anachronism for MIC is standing for. Inositol, I think, L-carnitine, and I forget what the M stands for, but these are supposed nutrients to help with energy of metabolism. Lipophilic B12 probably is valuable, and we do know that those who are blood type A tend to have a lower ability to make B12 because they don't have enough stomach acid and enzymes and intrinsic factor. But I have nothing negative to say about it. But for energy metabolism, I'm going to go back to what is truly the right thing to do. You have to look at your carbohydrates, how much protein you're eating, and fats. At least separate your dietary plate: 1/3 fat, 1/3 protein, 1/3 carbs at the most. And look at what you're eating. Try and not eat late. The older you get, the more you should shift your eating pattern to end your eating as early as you can in the day. So I had been for years when I was younger, I used to eat breakfasts and lunches and dinners. But now the research is pointing to, as you get older, you probably should be looking at, say, past age 50, 55, shifting to eating breakfasts and lunch and skipping the dinners, because the longer your stomach is empty, the healthier and the longer lived. That's a general theme to be. And then the older you get, the more you want to eat protein. And the older you get, the more you want to lift weights or do weightlifting at least 2 times a week, if not 3 or more. So these are the low carb, exercising, adequate hydration, not eating late at night. These are the tried and true foundations upon which you might add a lipophilic B12 MIC injection for trying to stimulate your metabolism. But usually injections are a foreign way of delivering material. I like it either intravenous or orally, you can get L-carnitine. That's probably a smart thing to do. Uh, uh, 3 capsules a day to help with fatty acid transferring and metabolism. But again, nothing you do will make a difference if you're not eating low carb and exercising and getting a good night's sleep. Because if you're too stressed and not getting a good night's sleep, the cortisol stress of your chronic insomnia and stress on your body will override, much of the good things you're trying to do. So we have to have the peace of Christ and get some good sleep and understand that chronic stress and cortisol will go against metabolism and weight loss, even with a bunch of healthy, good advice on supplementation and so forth. So hopefully that helps you, Mary. Um, let's see. The next question is Hayden. Hayden says, would you advise for a young adult female with spondylosis, back arthritis? She struggles to swallow pills, so you need to prioritize. Thank you for all you do. Well, how young? Usually spondylosis is where each vertebra meets the next vertebra, and then there's a little sandwich in between. Of course, this is kind of difficult to show, but you have your cushion between your two vertebra, and then the areas can start overlapping with irritation, and this is the arthritis. So instead of being separate, then these overlapping lips of calcium on the bone start creating bone spurs, which is arthritis. What promotes that? Well, a unhealthy food environment, rich in processed foods, carbs, starches, fruit sugars, and eating too late, eating inflaming foods, food allergies, lectins, oxalates, phytates, tannins, foods that are eaten too late at night. Maybe I repeated myself. Inadequate water. Most of us do not drink enough water. Half your weight in pounds as ounces every single day of your life. This chronic stress and inflammation, especially when we don't move and do range of motion like Pilates or stretching, the area becomes irritated and inflamed. That's why usually spondylosis is in the cervical spine and the lower lumbar spine. These are the two biggest pivot points and your back, where most of the micro trauma of the ligaments holding on to each vertebra are making little tears. So we're down to the very tiny level of the actual cells that make up bones and the membranes and all. So you have tiny micro stresses and tears. And as we get older, we get stiffer and we don't move as much. There are also genetic proclivities towards this. That's very rare, however. Usually it's a lifestyle, a diet, a food allergy, a lack of hydration, and lack of stretching and exercise. So when you're exercising, what could I use as a better example here? Let me use this one here. And let's say that's the pad, the disc. And when you lean to one side, and when you lean that way, you're squeezing that side. So you're squeezing out the water in the disc. And then when you come back up, then it imbibes the water through diffusion. And then when you do the other side, it squeezes that side, squeezes the water out of the disc. And then when you back off of it, it imbibes and takes in water. Imbibation is what it's called. So the disc itself doesn't have blood vessels. So it depends on you drinking enough water. And when you squeeze the disc leaning one side, then you squeeze the discs leaning the other side, that disc is getting squished on one side, water out of it. But when you release the pressure, it sucks it up like a sponge. So if you don't drink enough water, or you are just doing coffee, or power drinks and Gatorade, you are not going to have a good spine. You'll have this arthritic changes going on. if you're inactive, that'll promote lazy, kind of inactive, stiff lifestyle. Always sitting, watching computers and stuff is never good. So, what would I do for this? Well, I would do all those things. I would stretch every day, even if it hurts a little bit, to tolerance. Do stretching daily, maybe Pilates with an instructor twice a week to help sure you're getting a good range and some stressors there. Some weight lift to build up your muscles so that it holds your cage up. Weightlifting with real weights twice a week. Aerobic circulation twice a week. And systemic enzymes, I'm going to say you have to be on an empty stomach. And so those vital zyme, if you have trouble swallowing, they're little tiny, teeny, tiny pearls. So I would encourage you to use the vital zyme. That's the easiest to swallow if you're having pain. That will help reduce inflammation. You could use curcumin. There are teas that are curcumin teas that you might drink that would be helpful and anti-inflammatory and pain relieving. So that's the direction I would head. Fasting reduces inflammation, and intermittent fasting does that as well. Keeping your sugars low, a good night's sleep. We only repair really at night, so you have to have a good sleep cycle. So hopefully that helps you, Hayden. Then the next item is from Vivian. Vivian says, what brand of creatine to build muscle would you recommend? The brand, I would just say eat much more meat, more fish, more chicken, more turkey, more pork, more eggs, more bacon. I like the real thing with digestive enzyme. I don't know that these companies are quality vetted companies that make the creatine. Unless you go to some very much more pricier, high price. But why do that when you need to eat? Why do that when you're going to get that in eating meat, fish, turkey, chicken, beef, and eggs, and raw dairy, bacon, things like that? So I'm for a real diet rather than I'm trying to keep supplementation as limited as reasonable. So I don't have a name for you, Vivian. I have a suggestion to try and work with real food. And whatever your ideal weight is, let's say I'm about 30 pounds from my ideal weight. And so I would take that as the number of grams of protein I need to get in every day. So let's say if you're a 160-pound woman and your ideal weight would be 140, then you need 140 grams of protein a day. If you're a man, and let's say he's at his ideal weight at 180, then he would need 180 grams a day. So that would contain plenty of creatine in it. But it won't do you any good if you don't do weightlifting. And little bands and little 3 and 5 pound weights are just not going to cut it. You really have to get into a gym with a trainer and really learn how to push your weights. I use the machines only so I don't hurt myself, because free weights, the older you get or the less trained you are, you can hurt yourself with free weights, but the machines are very safe. Hopefully that gives you an idea, Vivian, of at least what I think. Vicki asked the question, what do you treat COVID with today? Well, I don't know that there is a thing called COVID. I've never seen it cultured. I see a PCR test and immunoglobulin testing that has had many false positives. So I don't know that I feel confidence in the test or in even the name COVID. Instead, I think we have, as we always have had, viral illnesses. And I think our diet is progressively becoming more and more nutrient deficient and calorie rich. So we're eating junk calories of no value and losing our nutrients, especially our B vitamins. So for every junk piece of sugar, carb, fruit sugar you have, when you send that through the engine to burn it to make ATP energy, that tricarboxylic acid cycle, Krebs cycle, has to take certain cofactors in the many steps there, enzymatic steps, to transport electrons into a high energy bond ATP uh, triadenosine phosphate molecule. It sucks up B vitamins. And so here we're eating a nutrient poor diet, low in the water soluble B vitamins, and we're sucking up whatever we have with a processing of valueless foods. If we were eating foods rich like meat, fish, chicken, turkey, beef, eggs, more humble vegetables, broccoli, asparagus, green beans, Brussels sprouts, spinach, and things like that, buttered, then we would be eating with our consumption a certain amount of nutrients and B vitamins. But we're not doing that as a people. We're being treated through lazy marketing to fall into our ease of living and buy junk food. And we're getting B vitamin deficient. That's a new area I've been researching lately. And thiamine, vitamin B1 is really one of the number one that can even be associated with the cell functions reaction to hypoxia, lack of oxygen. So you can imagine if you block the blood supply in a clot in a blood vessel to tissue, that lack of oxygen is going to hurt that tissue quickly. But the same metabolic changes in that tissue that is suddenly blocked from a clot of in the blood vessel, those same metabolic impact and changes occurs with thiamine vitamin B1 deficiency. If you go all the way back to 100 years ago, beriberi was a thiamine B1 vitamin deficiency disease, and it was associated with symptoms of almost all diseases that we know of. Every single disease, from emotional, mood, anxiety, paresthesias, tingling, reflux, heartburn, constipation, diarrhea, tingling paresthesias, palpitations, joint pains, everything that we know of in a symptom is mimicked through thiamine vitamin B1 deficiencies. And so quality vitamin B1 is really probably a hidden nutrient deficiency that's much underreported. And I am gaining more respect for it as I continue my personal studies. So if you're going to do anything with that, I would say we're talking not little doses, we're talking high doses. So at least 50 milligrams, which is in our TLC methyl B complex. And possibly that's one of the reasons why I do so well in my 70s now and work and able to carry on. I get that replenishment twice a day. I take 2 methyl B complex every day in the morning and evening before I go to bed. But the scary thing about this is the chronic hypoxic shifts in the engine metabolism of the mitochondria are the same things of the Warburg effect of Dr. Otto Warburg, who got the Nobel Prize, who described cancer as a chronic oxidation, oxygen deprivation, moving to fermentation. And all those metabolic changes were associated with being oxygen starved. And we can get the same reaction with chronic thiamine starvation. And so you would see beriberi diagnosed with dementia, Alzheimer's, kind of like psychosis, mood swings, dementia. Then there was this chronic skin issues, dermatitis, and then there was the chronic diarrhea. And so how much of what are we seeing is subclinical thiamine deficiencies? And I said all of that, Vicki, to say, just to encourage you about how much we can go through today to help us with our endurance and recovery level. And so that's the direction I would head. TLC methyl B complex, where thiamine is at least 50 milligrams on a daily dose. But they've gone up to, and I think it was Dr. Derek Lonsdale, who worked at Cleveland Clinic, a pediatrician, in the early 20th century, around the 1950s. He just died, by the way. He wrote the book on thiamine deficiencies mimicking almost all diseases. And he would use levels of thiamine uh, in the hundreds of milligrams, up to like 500 and 600 milligrams. I've never done that with a patient. I presume it would be safe and fine. It's water soluble. But at least the 50 milligrams a day, what we have right now, would be a good start. All right. So that's how we treat COVID with if someone thinks they have a flu or a bad cold, and we're going to go with ivermectin or hydroxychloroquine. We're going to give them a high dose vitamin C drip. We're going to give them D 50,000 units, one a day for 5 days. We're going to give them added zinc, zinc in the form of TLC multimin to get 25 milligrams of zinc in them every day. Tell them to be on a low carb diet, and we give them the enzymes to stop the inflammation. And sometimes we give a Z-Pack or not, but basically you should be able to otherwise heal from this for the most part. Denise has the question. Let me do Denise and we'll go to the live questions. How many systemic enzymes should I take for inflammation in my muscles and throat? I have very sticky phlegm, more so at night. Will the enzymes help to curb that, or is there something else I can do? I am 71 years old, in general good health. Also, can you talk a little about plasmalogen supplementation repair for the myelin sheath? Thank you. All right, so number one, very often as you build up phlegm, that's a feature of dehydration. The older we get, the less we crave water, and the less active we are, and the more dehydrated we get. Number two, with aging, we lose enzymes. And so you dry things up, make it stickier. You don't have the enzymes to chop up the mucoproteolytic chopping up of that phlegm. On top of that, with aging, our immune system decreases, and we tend to build up diabetes in that our muscles recede. And as our muscles recede, our pattern of eating carbs stays the same. So we're not burning down the carbs and starches. Therefore, our muscles build up. Are not able to burn down the blood sugar. So the blood starts filling up with blood, which depresses the immune system. So you've got to hydrate yourself, half your weight in pounds as ounces of water every day. Take the systemic enzymes, yes, on an empty stomach, twice a day. You could use N-acetylcysteine. N-acetylcysteine is used as a mucolytic agent. You could take supplemental iodine, 1 tablet or 2 a day. Iodine has always been known to be a mucolytic agent as well. Plus food allergies. You could be developing age-related maldigestion because as the old tube starts to get older and more holes poked in it, food reactivities can develop in the sensitivity range of immunoglobulin G, and then you'll get this buildup of mucus. The other thing is you could take some Argentine silver every night and rinse your nose with the antibacterial, antifungal, antiviral wonderfulness of the silver in Argentine silver. Now, regarding the plasmalogen for myelin repair, I have always been dealing with, and I worked with Dr. Stanislaw Brzezinski in Houston, Texas, on anti-neoplastins for brain tumors primarily, but there were many other cancers, and trying to turn back on tumor suppressor gene P53. So I'm published in some of the work with him, and what we found was the brain and all cell membranes is made up of 50% protein and 50% fat. So you have to remember that the membranes in your body have this double layer, okay? And if you injure it, you have to repair it. And the older you get, the injuries are harder and harder to repair. So those phospholipids are phospholipids. there are many different kinds. You can have phospholipids that are inositol, phosphatidylcholine, phosphatidylethanolamine. I mean, it has sphingomyelins. All of these things are fats that are designed to be the membranes for everything, all our 40 trillion cells, the inside, the outside of the cell membrane, and then the nucleus inside, and all the little intracellular organelles. They need the fat and protein. And what do people do when they get old and don't digest as well? They tend to eat more simple foods and fun foods as they get older and closer to their death. They just give it up and they just say, the heck with it, I'm going to eat for fun and not for health. And so they hasten their death because you need the very fat and proteins to help repair everything. Now, I have been telling people you get this by eating meat, fish, chicken, turkey, beef, egg yolks, and bacon and pork, all this kind of wonderful stuff. But we seem to have an ad campaign put on by corrupt lobbyists in our country to frighten you away from meat, frighten you away from proteins and eggs. And so we're all having less than we need for our repair. So we're starting to see the impact, premature aging and all the processed food, and they hydrogenated linoleic acid, and now they corrupted it through all the processed foods. So all the wonderful necessary essential fatty acid, omega-6 linoleic, is now hydrogenated through all the processed stuff. Now it's become harmful. So we have a lot more weak membranes, and with those weak membranes, we're not repairing them because we're not eating what we should, and we're not chopping up our fats and proteins because we don't have enough enzymes with aging. It's a big mess. So now come along at this point in time, all these products you can buy over the counter, spend your money for plasmalogen, fancy dancy phospholipids. And I've been doing this 40 plus years. So it's ridiculous. Eat your meat, your fish, your chicken, your beef, your eggs. Save your money and stop all these silly advertising gimmicks. And yes, of course, they'll have maybe a little quote of a study that I've done. I published in phospholipid replacement therapy. I could have called it plasmalogen myself, but there you have it. Just don't get sucked into all this stuff. Eat real food. God wasn't playing games with us and saying people have to wait until you get smart people to push a pill product supplement. Debbie asked the question, Analemma water wand versus other products. Hi, Dr. E. Just wanted to know if you've tried other products. Wu Go Su seems to be getting a lot of action. WU then space GO space SU. I'm not familiar with the other products. I will go look up Wu Go Su. Let me write that here. Wu Go Su. Okay. And we'll see what that says. But I can't speak to it because I haven't seen others. I have looked at the men. Dr. What was his name? Pops. Frederick Pops. He was a researcher in Germany and the Netherlands, many decades ago, on agriculture, horticulture research on water. And then the current people who are working with this are from the Netherlands. And so they have decades of research on this. Dr. Gerald Polak, Dr. Lin, who just died last year from Japan. No, he was from China. And these men have worked, and their product result is the Analemma wand. And so I've listened to many lectures and studies and protocols on this. And I would say, to me, the most impressive thing I've seen is the Analemma. Now, if this other one is out there, from Wu Go Su, I will clearly bring it up if I have time to look into it. All right, so much for that statement. Let's see, on the live, we have Cute Wild Amphibian says, if I'm having trouble with my sphincter, could that cause me to have trouble burping? and could possibly make me feel like I'm going to pass out, where I get a lot of pressure in my abdomen. Well, of course, if you're getting symptoms like that, you need to see the doctor locally, or urgent care, even ER, for feelings of near fainting. Yes, the GI connection, your stomach to your esophagus, the gastroesophageal sphincter there, can get tightened up from scarring. There's chronic irritations, Barrett's esophagus. There's potential for cancer changes there, and so this needs to be looked at. You might have to see an gastroenterologist with an endoscopy and actually look around, because yes, those problems may indeed be associated with that kind of a symptom. So that's what would be the first thing I would do, is see your gastroenterologist and get it scoped. Because if you're having symptoms like that, you need to get that solved acutely. She goes on and also says, when I tighten my abdomen muscle and like a pulling and I get pain, doctor wanting to give me a CT without contrast because my hemoglobin is 7.7. Will it show if I have a hernia? God bless you. Well, if your hemoglobin is 7.7, you are at that zone where you need a transfusion. You need to be worked up. You need to be seen. What's causing the blood loss? Is it chronic gastritis, reflux, and irritation of the lining of your esophagus? Is it Barrett's esophagus? Is there an ulcer? You had better get yourself in and have that worked up. Yes, do the CT. Yes, see that your nose, the gastroenterologist, and get an answer quickly, because that it needs urgent attention. So, cute wild amphibians, please get that addressed quickly. Back to the questions here. Debbie says, oh, I did Debbie with the Analemma water. Josie says, I completed a 24-hour fast and now started a carnivore diet plan for the next 2-3 weeks to lose weight after my vacation. I wanted to confirm that I can have whole milk or cream with coffee during this diet. Yeah, you should be able to. And after 2-3 weeks, I would like to incorporate veggies like broccoli, zucchini, Brussels sprouts, asparagus. Is that a good plan? Yes, the answer is yes, your plan is good. Can people develop problems with any food? Yes, they can. But again, a very few, when you go on a carnivore diet, you'll tend to move toward constipation, but that usually will self-resolve itself. And then when you go on these vegetables that are low carb, rich fiber, cooked, then normally they're very well tolerated. And those vegetables tend to not have a lot of lectins that would irritate the body. So that's a good plan, Josie. I don't see anything wrong with it. Kate says, what are your thoughts, experiences with BCP 157 peptide? Here we're coming up with these peptides for joint pain, neuropathy, gut health. Have you seen any negative side effects from injections or capsules? Thanks. Everyone wants to make money on a ride the wave. And we are learning that us functional doctors were right all along, all these decades, about the need that food makes a difference, and the amino acids and the antioxidants, the vitamins, all make a difference. But isolated treatments, there are some injectable peptides, there are some dietary peptides, there are various ways of taking this. These are emerging, and I haven't seen enough data and outcome to be convinced that this is worth my time and effort. Because you can inject everything you want and eat a lousy diet, and all that money spent on those injections will be valueless if you're eating a high carb, high inflammatory plant based diet. with foods you are reacting to. It's pretty traditional to say that meat, fish, chicken, turkey, beef, and eggs don't tend to have lectins or anything inflammatory. I have seen beef, I have seen eggs, I have seen, pork, I've seen fish, but rarely. These are usually from the tube itself having so many injuries that when you do eat eggs or meat or fish or chicken or beef or pork, those digested parts leak through these injured holes caused initially by plant lectins. That's my experience. So I am not in favor of some miracle supplement, peptide, or miracle phospholipid like the other question was before. If you would just spend your money on a healthy, disciplined, low carb, uh, cooked vegetables with meat, fish, chicken, turkey, beef, and eggs, that's the way to go. You start using a digestive enzyme, especially if you're an A type blood with hydrochloric acid in it. If you're older, start using it also and see if it helps you with digestion. Krista says, I was wondering what your advice for a better night's sleep and what you would recommend taking, anything to help. I've also been feeling tired and would appreciate suggestions to gain more energy. Thank you so much. Well, I would wake up early in the morning and stand in the rising sunrise light, the infrared long waves. They'll penetrate your skull. Take your glasses off. It'll go through your eyes, your clothes. Stand outside with your feet in the wet grass every morning, somewhere between sunrise and before 8 a.m. for 2-3 minutes. And then make sure you're getting in bed. Have good light hygiene. Get the lights dimmed. Try and get regular incandescent bulbs. Get all these LED blue light, light damage, intoxication out of your life. Don't be watching your screen late at night or your cell phone. And shut the electronics off. Get them away from you in your bedroom. Make sure that your electricity or the electric input to your house isn't right next to where your bedroom is and the head of your bed. Those are things to do. You have to be well hydrated in order to sleep. The Analemma water has instantaneous alpha wave calming, instantaneous upon drinking structured water. You can look at Analemma, ANALEMMA water-.com. Analemma, ANALEMMA, one word with 2 M's, water.com. And scroll on that website and you can see the brainwave studies. So you need good hydration. Natural hormones help the sleep. And then the B vitamins are very, very important. The methylated B complex, I would take plenty of those. TLC methyl B complex. Magnesium or a good multi-mineral is very important. And not eating late or drinking alcohol. So if you could cut your eating off around 5 o'clock or so, that would probably be the best thing to do. And then hopefully that'll help. A little melatonin. You might try TLC Good Night or some melatonin as well. So Kate, Krista, I hope that helps you. Krista also said, hi, I am a teacher and would like to know how to keep my immune strong during the flu season. Thank you. Well, eat a low carb diet, get up in the morning and get your energy from the sun to energize all your exclusion zone water, negative water that surrounds every cell membrane. Drink enough water, be low carb, take supplemental vitamin D3, usually 10,000 with K2, 90 micrograms, one a day. Take zinc supplement, as we have TLC multi-min zinc to get 25 milligrams in. And with the zinc, with the vitamin D, with a low carb diet, with getting up with the sunrise outside 3 minutes with your feet bare in the ground, and getting enough water in, that should do you very well. I would add to that probably just a good multi-mineral and taking iodine orally. Jill says, thank you for doing your weekly show. I really get a lot out of it. Would you be able to give advice of what to do before or after a CT scan to help with detoxing the exposure? It's of ear, sinus, throat, if that matters. Maybe you're just worrying unnecessarily. Uh, Come in and do an EDTA chelation with immune drip after it, and that'll help pull that gadolinium out immediately. You might do it a second time the next week. That'll be very, very helpful. Sylvia says, you mentioned grounding is good to step outside on the grass, but since my house has no grass area, do the grounding sheets that you connect to the ground part of the electric socket work good enough? Yeah, well, I would do that because that's the only resource you have. So if you can get down to the beach and walk on the beach in the wet water sand right next to the waves landing on the beach in your barefoot once a week, that would be helpful too. Every good thing matters that you do. Yes, the pads may have a benefit, and yes, I would consider doing that. So let's see. On the live, cute wild amphibia said, yes, I have chronic GERD. Okay. And then she said, thank you. Okay. And Carolyn Morelli said, what about Cologuard test versus colonoscopy? Well, the Cologuard people want to try and, if possible, replace the need for a colonoscopy. I don't think that will ever happen. They're both really screening for cancer, but the value of the colonoscopy is an actual visual picture, and the physician can get an idea of the health of the mucosa of the lining of your colon. So I don't think there's anything that'll replace that. So Cologuard will do some PCR testing and blood screen for potential cancers. I think do a colonoscopy, whatever your doctor recommends and finds, and then do the Cologuard in between times. And so I'm going to go ahead and there's one more. I'm going to have to end with Anita Think of All. Dr. Ellithorpe, please read and reply to my question that I hope to have your advice before my doctor appointment tomorrow. Thank you, from Aneta. I don't see it. I don't have it here. I don't see it, Aneta. And so type in quickly, what is the issue, Aneta? And then maybe we can get an idea since you have your appointment tomorrow. Can you type that in real quick? We'll pause for a minute. What time is it? 7:03. I don't see Aneta here. I don't see anything on you. Maybe you got your question in too late before it was. They cut off the last printing at 4:55 p.m. Oh, let's see. Does the removal of an umbilical hernia require a local or full body anesthesia? It depends on how big it is. So that's where the problem is, Aneta. If it's small, I have heard over the 43 years I've practiced local anesthesia, but usually umbilical hernias do require full general anesthesia. So that's the best I can suggest for you. That's my experience. So I would think it's small. Well, then talk to your surgeon about it, or just get a spinal and ask him if he could do the surgery with just a spinal or a local. So that would be my suggestion. All right. To all of you, God bless. If this is of value, please like before you go, and subscribe if you haven't subscribed. Share with a friend, and see if this can't get out to more people to be able to give them questions. We may open up more time, but there you go. All right. God bless. Take care. All right. Bye-bye.